you do if you work in payroll, if you work in pharmacy, if you work in estates, if you're a nurse, if you're a clinician, and anywhere in between. You are part of a chain of people that care for patients. And you cared for me, and you saved my life, and there's nothing better outcome than that. I am living proof that the NHS works, and I'm living proof that Barts is capable of giving world-class care. I receive world-class care at your hands. The world's best care. It happens. It says here, celebrate what we do well. We don't do enough of that. We don't celebrate the work that we do. It's great to hear from Stevie. But why don't we do this every day? Why don't we sing from the rooftops that we save people's lives, we deliver children, we give people great care, and when we can't, we give the best end-of-life and palliative care that we can. This is Barts Health, and it means something. We are the largest NHS organisation. We are the largest healthcare provider in Europe, and you're part of it. You have the privilege every day of serving a community of people that really need you. When I came underneath your care, it's the first time in my life, other than being a baby in arms, that I said, please take care of me. I handed my life over to the care of you, and you did a perfect job of it. Why don't we celebrate what we do more? Why do we always focus on the negatives? What isn't right? This isn't right. The IT's not working. We haven't got enough money, etc. I know this today. While we're standing here, there are people coming in our A&E, they are walking through our front doors, and we are caring for them, and hopefully we're getting them well and they are going home. And everybody in front of me has a role to play in that. But yet we don't talk and we don't think and we don't discuss that enough. Barts Health is the sustainable model of the NHS. Organisations do have to come together. We do have to be more efficient. We have to think of different ways, profoundly defined ways that we move forward together. And even the younger people in our audience, you are the future of that. We are the future of Barts Health. I'm extremely proud to be working as National Patient Champion with Barts Health. I've come from your hospital bed, where I nearly died, into working with you as a peer to try and make Barts Health what it should be, the beacon of excellence in the NHS. We're not there yet, but we will get there. You have to believe that. I believe it, that's why I'm here. Thank you everybody, each and every one of you, for working at Barts Health, being in the NHS and caring for our patients. Lastly, I think what we need to do more of is care for each other. All I keep hearing at stories at Barts Health is how people don't treat each other well. People speak to each other rudely and aggressive, put too much pressure on you. We need to care for ourselves as well as our patients. We need to listen to each other. We need to communicate better. Just stop for a moment and think of these pictures here from the 1970s and now. Just think how much this community that we serve has evolved. Just think of how healthcare has evolved in those years. But one thing that hasn't evolved is the need for the NHS and the patients you serve. They're the same patients with the same illnesses coming through the same doors. They just might be a bit newer. And you've got the privilege of serving every day. Every day, a privilege. It's been a privilege to stand here for 5 minutes. Thank you again for serving the NHS and the community in East London. Thank you.